Hi everyone, I am Swapnil Banerjee and today in this video we shall learn about the Leopold Maneuver. So we have mainly 4 Leopold maneuvers. They are the Fundal Grip, the Umbilical Grip, third one is called the Pawlik Grip, and finally we have the Pelvic Grip. And here I also have a mannequin on which I shall perform the steps of Leopold Maneuver. Now you will have to remember that there are a few prerequisites before performing these maneuvers. Like you will have to take the verbal consent, you will ask the patient to empty her bladder, and after that you will have to explain the procedure what you will have to perform on the patient. Now you will take the patient to an examination room for maintaining the privacy, and the examination should be done in the broad daylight to make the patient lie on supine position, and here the legs of the patient should be flexed for performing the examination. After that you will have to warm your hands, and after all that done we shall move towards the main examination. And here for doing the examination, the examiner will stand at the right side of the patient, and the first 3 of this maneuver will be done facing towards the face of the patient, and the last one will be done facing towards the feet of the patient. Now I shall perform the demonstration on this mannequin. So now we shall demonstrate the steps of Leopold maneuver. As I have already told you, you will have to first remember about the prerequisites. Then you will have to expose the abdomen area of the patient. So the exposure shouldn't be less or shouldn't be much. It should be adequate. Like here I have exposed from the semisternum to the pubic symphysis. And after that we shall perform the Leopold maneuvers. So before doing the fundal grip, I shall ask you to take the fundal height. So for doing it, you will have to firstly centralize the uterus, and after centralizing it, you will place the ulnar border of your left hand from semisternum and will start palpating it. So after palpating it, the part where you will get a resistance, take that height by taking a measuring tape. That will be the fundal height. So for performing the fundal grip, you will have to stand facing towards the face of the patient, and now you will place both of your hands and gently press by them. Now if you are feeling a hard globular structure, then it is the head part of the baby, and if you are feeling a broad, soft and irregular mass, then it is the breech part of the baby, and thus it tells us about the lie of the fetus. Now we shall perform the second Leopold maneuver. So for performing the umbilical grip, you will have to place both of your hands at either side of the umbilicus. Now you will have to fix one hand, and by other hand you will have to palpate. If you are feeling knob-like parts, then that is the limbs of the baby. And if you are feeling a curved and rounded part, then that is the back part of the baby. Now we shall perform the third Leopold maneuver, or the Pawlik grip. So for that you will have to outstretch your thumbs and fingers, and it will also be done facing towards the face of the patient. You will place your hand above the pubic symphysis. If you are getting a hard globular structure, then that's the cephalic part of the baby, and if you are getting a soft, broad and irregular part, then that's the breech part of the baby. And you will also try to move that part. If it is palatable, then it is probably not fixed or engaged, and if it is not palatable, then the part is engaged. And finally we shall do the fourth Leopold maneuver, and for that we shall face towards the feet of the patient, and this time we shall place both of our hands parallel to the inguinal ligament, and we should try to approximate our hands. If our hands are diverging, that means probably the presenting part of the baby is engaged, and if it is not diverging, it is converging, then that means the part is not engaged. So this part of the maneuver tells us about the precise presenting part, attitude and the engagement of the fetus. And now remember, if the lie of the baby is transverse, in that case you will not get the first, third and fourth Leopold maneuver. So that was everything I wanted to tell you about the Leopold maneuver. I hope it was very easy to understand for you all. So thanks for watching, have a nice day, and subscribe for more such educational videos. Bye.